the fact that this is even a conversation that we're having about, hey, can depressed persons go to a doctor and get a pill to kill themselves? Like, that tells us a lot about how little we value life in our culture right now.
Last month, the Oregon State Senate heard the proposal of an amendment to the state's Death with Dignity Act that would reduce the waiting period for dispensing a legal dose of medication from 15 days to just 7. Already, Oregon had removed its residency requirement, reports the Oregon Capitol Chronicle, making it possible for patients to travel to the state with the intention to die. Oregon is one of 11 U.S. states that permit medically assisted death, and this new bill sits alongside New York State's recent Medical Aid in Dying Act that passed in the state assembly and awaits review in the New York State Senate. 18 other states currently have legislation in process that allows for similar outcomes. Joining us to talk more about this is our own Emily Belz, who is currently doing reporting around this topic. Emily, thanks for joining Russell, Mike, and me for this conversation.
Wonderful to be with you.
So, Emily, can you give us a lay of the land? What are these states actually proposing? Who's eligible for medical assistance in dying?
Yeah, so we have a lot of legislatures that are discussing this issue right now. And this year, Delaware legalized assisted suicide. And New York also passed it in the legislature. It's just awaiting the governor's signature now. And a lot of advocates are working to potentially get her to veto that legislation. So the debate is very hot, I would say, but generally what's passing in the United States is physician-assisted suicide, which means that you request as a patient your doctor to give you a lethal dose to take. And that's different than some other countries like Canada or the Netherlands, where a doctor can directly give you a lethal dose. But a lot of the concerns are, the slippery slope that as these things pass, they expand, and that there will be abuses. And that's what the coalitions of Christians who are opposing this in state legislatures in the United States have found a lot of common ground with other groups like disability rights groups and people who are concerned about health inequities in minority communities. It's just a really interesting debate to observe from the outside.
Are there any particular limitations on who qualifies for physician-assisted death and how this can be carried out?
Yeah, so that's varying by state, but in New York, for example, where I am, the requirement under the new legislation is that you are terminally ill and within 6 months of death. And so there's often requirements for a mental health evaluation before this is prescribed, things like that, to try to put some curbs on the practice. But I think the overall message that's often not conveyed in media coverage of these things is that this is not a mainstream medical position to pass this kind of legislation. The American Medical Association just this summer reaffirmed its opposition to this practice, and the main reason they give is that it shifts the doctor-patient relationship. The norm changes, and even if there are curbs and protections for abuses of this practice, they're saying that the underlying issue is that the norm changes of doctors being healers instead of someone who prescribes a lethal dose of something.
Russell, I feel like that's really fascinating because a 2024 Gallup poll found that 66% of Americans believe that doctors should be allowed by law to assist a patient to commit suicide. How did we get to this place where 6 in 10 Americans think that this is okay, and yet doctors feel apprehensive about it?
Well, because doctors start out from the very beginning taking a vow in terms of being the people who are healing, people who are directing people toward life. And there does, even just at the psychological level, that requires a certain amount of trust that I'm ultimately not going to be recommending that you die. And there are a lot of doctors also recognize the huge economic pressures that come with having to decide whether or not this life is worth continuing treatment or not, and let's just fix it with this. So that's one part of it. The other part, I think, is that there is there's an accurate human revolt against death and the idea of death and suffering that is easily redirected toward well, we can help you to do this in a way that can take the sting out of it by simply having it happen on your own terms and having it happen in a way that's painless and can fix the problem in a way that doesn't understand the way the biblical vision of humanity sees the glory of what it means to be alive, even embedded in suffering and death. And so you have a lot of people who, if you talk to people, and I've talked to many people, Christians who nonetheless were being tempted toward this kind of thing, often what they're thinking about, in my experience anyway, is not even their own suffering. What they're thinking about is, I don't want to be a burden to the people around me. Well, that's not a Christian view of reality. We can understand why we can fall into that, but that's why we need the rest of us to say, you're not a burden. You're one of us. You're part of the body. That takes a lot of countercultural messaging, though.
Yeah, Emily, you had referred to religious organizations that were pushing back. Are they pushing back against that message of being a burden?
Yeah, I think the advocates for assisted suicide that are pushing this in state legislatures, they're often using the language of autonomy, that this is something that gives you a choice. And the Christian groups and the Coalition of Disability Rights Groups and others that have opposed it, their message is actually this takes away autonomy from people who are vulnerable, and it puts pressure on them, like Russell was saying about being a burden to your family, being a financial burden. And hanging over this is the example of Canada, which is just north of me and is kind of ever present in the conversation here in New York. But they passed medical assistance in dying back in 2016, so they have kind of a long track record to show on that. And there have been a lot of abuses, a lot of examples of people who are poor or have mental health challenges who have been pressured into taking this path instead of seeking treatment. And I think one thing that is important to mention as well is that the Christian groups in the United States who are working on this have been pushing, along with opposing assisted suicide, pushing for better palliative care, which is just not something we do well in the United States. And so I think they're trying to say, okay, maybe not assisted suicide, but maybe we can do end of life a lot better than what we're doing right now. And I think the public often doesn't understand the difference between those things, that there is better palliative care available that is not the same thing as taking a lethal dose of a medication.
And Mike, former Bulletin guest Lydia Dugdale wrote a really brilliant New York Times op-ed saying that depression is increasingly playing a role in these conversations around physician-assisted suicide. She noted that New York's new bill doesn't require a mental health professional to even screen for depression unless that person's doctor thinks that a medical disorder or a mental disorder could be impairing the person's judgment about ending their life. I wonder what this communicates to people about mental illness in a season where we're really trying to destigmatize things like depression.
Yeah, no, I mean, I think, and I think this is one of the most important frontiers in this entire conversation is the role of mental health in all of it. I mean, there's a lawsuit on the books in Canada because so as of right now. You are not eligible for medical assistance in dying in Canada only on the basis of a mental health diagnosis. But there are people who are suing and advocating the Canadian government to say that should be grounds enough for someone who wants to die to have access to medical assistance. So that's excluded on the books as of right now, and they're doing an extensive evaluation, and who knows what the outcome of the evaluation will be. The but they're doing an evaluation to basically assess, hey, can we include this? Can this be part of the program? People with significant mental illness be part of the program. And I think the fact that this is even a conversation that we're having about, hey, can depressed persons go to a doctor and get a pill to kill themselves? Like, that tells us a lot about how little we value life in our culture right now. Like the degradation of the idea of life in our culture. It's just kind of a living nightmare, I think. And I think what this will unleash, I mean, this is, again, you kind of go back to some of the early conversations about euthanasia, the early arguments around this issue from 20, 30, 40 years ago. And, you listen to like the Christian voices that were sort of sounding the alarm around this, Francis Schaeffer and others, and they sounded paranoid and apocalyptic, but they were right. This is where it's going.
Yeah, and it's not a small group of people in Canada. It's 1 in 20 deaths now are assisted suicide in Canada. So
that's insane.
That is, it's a big number, and I think that's why advocates in the U.S. are so worried about how that might present itself in the United States.
And one more thing I just want to make sure that we emphasize for our listeners is when you look at the groups that are advocating against these policies, especially where they haven't been implemented yet, where they're sort of resisting them, it's groups that advocate on behalf of people with disabilities. There is palpable terror in that community to say, again, on the basis of all the things that we've discussed here, the pressure that emerges is, well, you're a burden on society, you're a burden on your family, and here's an easy way out. It's just a pill. It's an easy way out. I think we ought to be far more alarmed about the pace with which this is spreading than we are.
Yeah, I followed. So I've been following this for about 10 years in New York. The advocates who've been fighting assisted suicide here have been fighting it for about a decade, and successfully until this year, which I think is maybe a point that is encouraging, is that state legislatures are influenceable, and a small group of people that I followed were very influential in preventing this from passing for 10 years. But one of the people who was really active on this was a Marine, a Catholic Marine, who was young and had been diagnosed with brain cancer, given a few months to live. And he decided with those few months he was going to go to legislators and tell them, please don't pass this law. And basically talking about suffering and the value of life within suffering, and how his life with his young family was still worthwhile. I think it was interesting too, because he had this terminal diagnosis, but he lived 4 years after the diagnosis. So I think that also shows these so-called safeguards that are saying, well, you're about to die if you get this diagnosis. We don't know all of those things. And so it's not, for him, he had another kid in the time that he had.
Wow.
And I think his family, I mean, I spent a lot of time with them, and they just were enjoying the time together, even if they didn't have perfect quality of life. So I think seeing those stories alongside some of the media stories that we've seen, where it's a sympathetic person who's faced with a terrible diagnosis and chooses to do assisted suicide, I think it's good to balance that with these other stories too of suffering and maybe some of the beauty that can be present within that.
Russell, as I've read many of the stories of folks who have made a decision for physician-assisted death, they often say, you just don't know how hard this is. You don't know how much this hurts. And I wonder if, as Christians, we need to develop a better theology of suffering that includes the nuances that Emily is talking about, not simply what could be viewed as a toxic positivity of choose life, it's still good, but being able to weave in the story of suffering along with hope in a way that's actually convincing to people who might feel like a terminal diagnosis is only suffering until it comes to death.
Well, no one expects somebody who is in the actual nexus of suffering to be exempted from that in a way that person can stand outside of it and, well, you ought to see that your life is I mean, that's part of the suffering. So, I mean, I think of Jesus on the cross is referencing Psalm 22, my God, why have you forsaken me? I mean, that's the depth of human suffering. That is not sinful. That is not condemnatory. What we need, though, are to be those who are gathered around that person in order to understand that, to serve and to care in every way that we can, and also to be the people who are preparing and shaping our own intuitions and our own sort of mindset before we get to that moment, so we really can remind ourselves and remind one another that we walk through the valley of the shadow of death. It really is a valley. It really is a shadow. It really is death. I will fear no evil, not because there's no evil there, but because you are with me. Your rod and your staff, they comfort me. I mean, that's not just a positive reframing of something really dark. That takes seriously the darkness, but also sees the glory that comes with light.
Emily, as you reported on this story, what kind of alternative solutions did you hear batted around when you talk about palliative care? Is it better pain management? Is it better trained doctors? What systems do we need to support people who are struggling?
Yeah, I think that the issue is systemic, and so I think there's a lot of kind of small issues with insurance reimbursement and those kind of things that legislatures and local jurisdictions can pass that improve the options available to people. And so I think it's not very exciting to get into the bureaucratic details of it, but yeah, I think it's in-home care. It's providing support through insurance or often through Medicaid or Medicare that people are relying on for those moments. So I think there's also just the issue of people learning how to do caretaking, I think, in their own circles, and so it's bringing that issue more to the forefront of death is not something we think about in American culture, so suffering is not something we think about, but I think the Christian groups that I've talked to want that to be more in the conversation of telling the stories of how you do this well, learning even on an individual basis with your families how to do this well. So there's a lot of different levels to it.
Mike, chronic illness, terminal illness is often so isolating. It seems like really one of the primary ways that Christians can be of assistance here is to offer Christian community.
No, I think that's exactly right. I remember a few years back, I was I heard about this really fascinating initiative from an entrepreneur who had seen the stats, because the stats are very obvious that the number one reason people pursue medically assisted suicide is because they feel like they're a burden to the people around them. And there's a company called Care that was founded by this woman, Jessica Kim, and the basic premise of this whole thing, the name of the company is Care because it's I am not alone. And that's a whole another topic in terms of what she's doing with Care. It's kind of a fascinating story. It's a really interesting project that some friends of ours at Praxis have been involved with as well. But the point of it being, it's the isolation, right? It's the feeling of because the flip side of this, one of the things we haven't talked about, is how sort of dehumanizing medical care itself can actually be. You're fighting cancer, you're trying to stay alive, and someone shows up on your doorstep with peanut butter cookies, and you go, well, I don't even know if I can have these. So there's a 2-hour long, hold time phone call, with this doctor and that pharmacist and whatever else. Is there going to be any kind of weird interaction if I eat these peanut butter cookies? And more likely than not, probably what's actually happening is one of your loved ones is the one that's actually on the phone making those phone calls, doing the heavy lifting to try to find out whether there's some kind of risk in all of this. People who are battling terminal illnesses are often asking those questions about everything from, the mouthwash they use at night. Can I have a Tylenol when I have a headache? Why haven't I been able to keep food down for the last 3 or 4 days? Like, it can be a brutal process to fight one of these terminal diseases. And community is essential. And, I think we've said this a variety of ways here, but it really is critical that the church learns to show up with compassion and presence and patience in those moments, so that people understand that, again, they're not alone in these fights. Like, it's worth it. If we get a few, if I think about my own father's death, my father died of cancer. It was a bizarre set of circumstances. He died very, very suddenly, and I look at that and that story, and I think, man, if I could have one more phone call with my dad, if I could have one more lunch with my dad, I'd give anything for that. And so I think those are that's the perspective that often gets lost in all of this. And part of the reason that it does get lost in this is that there's something about sort of the soulless bureaucracy of trying to stay alive that is itself very, very dehumanizing and defeating. And if you don't have community around you to help, press through all of that, it can be crushing.
Well, and that young Marine who I spent time with, who had the terminal diagnosis, he was saying how it totally changes his mentality about the whole experience of going through this, to have the option of ending it at any moment. And I think that was what he was concerned about, because he said, if that pill was sitting next to me on my nightstand, there's a lot of moments where I would have taken it and I would have regretted it. So I think just the idea that it introduces the option is what was troubling to him.
Well, a story like this reminds us that there are so many hurting people in the world right now. If you are having thoughts of suicide, call or text 988 to reach the 988 Suicide and Crisis Lifeline. Your life is precious to God, to those who love you, and to us here at the Bulletin. Listen to the full episode wherever podcasts are found.